Uncensored and Unfiltered, and happy Wednesday, happy hump day. We are so excited to be here with the beautiful Jexi. Hey. With our beautiful Dunya.
Hi, everybody.
We'll get a little more details about those beautiful glasses a little later.
You don't want me to take them off.
Uh-oh. And our wonderful Dr. McDaniel.
Hey guys.
Woo! So we are so excited to be here with you and to answer all of your questions regarding surgery and a little bit more. So let's get straight to it. Dr. McDaniel, I saw you in the OR earlier.
Yes.
What procedures were you doing today?
So I did 2 BBLs today, and thankfully we're in between cases, so we're flipping over. We're going to do another BBL and then 1 more liposuction. So that's 2 more cases to go.
Okay, fantastic, very good. And what are your other cases?
Tomorrow we've got a couple of cases. We've got breast reduction, we have a tummy tuck, and we also are doing a breast lift with that, and then we have I believe 2 liposuction cases.
So you're actually one of the few surgeons here in Avana that perform facial procedures. Tell me a little bit more about what type of facial procedures you do.
Sure. So facial surgery is one of my core training. I really enjoy facial surgery, and whenever I was considering coming to Avana before I started here, I thought it was something we could add to the practice and do a lot more of. I know people do it here, but hoping to grow that, and I'm continuing to grow that. So I love facelifts. I do rhinoplasties, brow lifts, submental liposuction is very common. And then otoplasty is pretty rare, and it's usually in younger individuals, but adults can have it done too. People with prominent ears, some really interesting cases.
Can you just
I have a friend that.
Yeah?
So, doctor, if you have to choose one procedure as your favorite one, which one will be and why?
Probably my favorite surgery is a facelift. I think that you can really make a drastic change immediately, and women love the results. They're at a point in their life when they're kind of starting to doubt their confidence, perhaps, and they're getting older, and it's a way to turn back time and give them that confidence back.
Amazing. That's great. That's amazing. And you did say something about chin lipo.
Yeah, that's a very common surgery.
Very common. I know that's something.
Mhm.
Yeah, and you can add it on to a procedure that you have.
Yeah, it's pretty easy to do. You know, a lot of times we don't like to do too much surgery together for patient safety, but this is something that's pretty low risk, low morbidity, so very little blood loss, and so it's something that can be added on to most surgeries.
Now, if you're afraid of some of the loose skin from the liposuction, so once you get rid of that fat and you're scared of some of the loose skin, what do we have here? Renuvion?
Yeah, so Renuvion is a great option for someone who, especially is a little bit younger, meaning less than 60 probably, you have a little bit better contraction of that skin. You know, liposuction removes the fat, but it leaves a little bit of space there. It's going to shrink that space up, kind of like cellophane when it heats up, it shrinks. But someone who's older or even younger who may want a more dramatic change, that's when a facelift would come into play.
And so how do I know if I'm ready for a mini facelift? Because I'm telling you right now, I've started to notice that I have these smile lines, which are beautiful. It means that I've been smiling a lot recently.
Yes.
But it makes me look a little bit older. And I've been kind of doing this to myself in the mirror.
And that's what I do in the consult.
Right?
For patients.
And I see that I do have a little bit, but I'm only 35.
Yeah. You're way too young for a facelift.
Okay.
Okay, so what you would do is something that's kind of an accessory procedure, something like fillers, something like Botox, really to just give you a little bit more volume where you may have lost it. We all start to lose volume in our late 20s, that's known. And so these things like Botox and fillers can help maintain things until we get to that point when we do need surgery. And
Right.
so that point is usually you'll have more jowling, you'll notice more skin. If you look from the profile beside you, you'll see loss of an angle. You've got a nice angle to your chin. Some
Tell
people,
me that.
so some people just go straight down, and those are the
Sure.
ones that we can reposition that tissue and really turn back the top.
So I know we do Botox and fillers here, which are absolutely fantastic. I'm a huge fan of Botox. In fact, I need to get mine done already.
Me
It's
too.
time.
Me
Yeah.
too.
So let's do it together. Let's do it
Yeah,
together.
we do
for
a
everyone.
live one, we do it.
I think it's
Perfect.
beautiful. Let's do it. It's not painful at all, and we should definitely do it live for all of you guys to see just how easy and painless it is here at Avana. But I was thinking about doing fillers. The only thing about fillers here is I've seen when I use fillers that my body dissolves it a little bit quicker than I'd like. So is there an alternative like fat transfer?
Yeah, that's a great option. So most fillers are made of hyaluronic acid, and so that's a natural compound in our body, and it gets broken down like most natural compounds. So some people will metabolize that faster than others. And so,
And do you think that people metabolize fillers more often because they're just using those muscles a little bit often?
you know,
Like eating, drinking.
In my case, I sing
Singing.
and I act a lot.
Yeah.
So my expressions are very
Yeah, doing as
strong.
always with a mic.
Yeah, with the mic in my hand, you know, close to my mouth.
Yeah.
Yeah.
So-
Yeah, it's always tough.
Oh, Gigi.
Sorry, I had to. I had to.
so
Don't use the excuse of artists, let's just say. So will that affect?
I think
Your
that more
fillers.
animation, more movement, it definitely can metabolize it faster. And someone who's more active or thinner, their body obviously has a higher metabolism. So that's
And it's
all plays in.
genetic as well.
It definitely is, yeah. So to answer your question, the fat grafting is very nice.
Yeah.
There are other fillers that are something made a little bit different that last longer. Something like Radiesse, for example, can last up to 2 years sometimes.
Oh, wow.
And so those are different, but those aren't dissolvable. So you need to know that you like the change before you commit to it. Fat grafting is the ultimate change because that's going to incorporate into your body and it's going to stay for your whole life. You know, just like a BBL, that transfer will stay once it heals.
So we can transport fat from my love handles to my. I'm totally serious.
I agree. I do it all. It's definitely
Are
a
you
real
not
thing.
like this with patients when they ask you?
I tried to.
I'm serious. We'll take some out from here,
Okay.
and then we can put them right here.
That's
When can we do that? Can we do it?
Can we do it?
tomorrow?
I'm here.
Okay, very good, very good. And you know, a patient just asking is what's the difference between a BBL and a fat transfer to the hips?
That's a good question. And so it's a similar in terms of the liposuction, the shaping and recontouring of the abdomen and core. A lot of it has to do with where we're putting the fat. So with a BBL, sometimes you will have some transfer to the hips, but most of it's going to the back for projection and to improve that shape. With the hips, I actually just did a consult for a tummy tuck, and I told her, you know, we need to add some fat to the hips to really help accentuate your silhouette from the front. And I think that's an example that shows you can still sit on your butt more with fat transfer to the hip because you're not going to compress the fat in the hips. So I think those are a big difference, but the preparation of the fat, the procedure and technique for injecting is the same, it's a different location.
And do you recommend massages?
I do. Yeah, absolutely. Any liposuction, which is required for all fat transfer, is important to get that massaging because it's going to help get rid of the fluid and shape the results and really contour things into where the fat is transferred to.
So let's say you just had a baby
Mhm.
a few months ago, and you're considering getting surgery. You want to get a little bit of liposuction done, a fat transfer. You want to do a procedure. You want to get a procedure done, but you're not sure you're gonna have a second baby.
Mhm.
Should we wait? Should women wait?
So yes, I think that it's good to wait until you know, number one, and then also give it time for your body to heal after pregnancy.
Right. How long after pregnancy?
I mean, really at minimum 6 months, but even 12 months is better because it takes a while for your, not only your volume to come down, but your skin to contract, all of those changes after pregnancy. But you know, if you're considering having a second child, that's when a tummy tuck, I would really recommend waiting until after you're finished with children because any repair of those muscles we do, it's going to separate again. You're going to actually have the same surgery done again, which becomes a more difficult surgery. Any revision is always more difficult.
And how do you know if you're good for a tummy tuck or just another lipo?
Number one is if you have separation of those muscles, so diastasis. And then also, if you don't have a lot of volume, but you have a lot of loose skin, that's really when a tummy tuck is going to make a very, very big change and a nice change for you.
When you say diastasis, what is diastasis?
So that's separation of your rectus muscles. So your core muscles that run vertical here, as you have pregnancy or you gain weight, those will tend to separate because your internal organs and your visceral fat has pushed all that out. So once we've taken off the skin, we can repair that and give you that nice core again. So it's nice and tight.
Doctor, do you think it's good to get the BBL first and then the tummy, or tummy first and then the lipo 360 and BBL?
That's a good question. And so when we do the tummy tuck, we can't liposuction the upper abdomen. And so we can't take as much fat. So typically I will say your better result is to do the liposuction completely 360, transfer the fat, let that heal, and then come back and do this. Because also your skin is going to be much looser then because we've removed the volume. And I think your tummy tuck will have a much better outcome.
And how long do you have to wait to get the tummy?
It varies doctor to doctor. For me, I recommend 8 to 10 months because you want all of that swelling to go away because again, if you're swollen, you won't be able to get it as tight as you could otherwise.
Great, now you know.
Very good. So as you can see, Dr. McDaniel is very educated in cosmetic surgery. He knows the ins and outs of facial procedures, body procedures, tummy tucks, lipos, everything. He's definitely not new to this industry, but he's new here to Avana, so you may not know so much about Dr. McDaniel. So now we're gonna get a little bit more personal with him, so that you get to know him on a more personal level. So doctor, tell us a little bit about you.
All right, so originally I'm from North Carolina. I've kind of trained all over, Michigan, California, North Carolina again. I'm married. I have two beautiful daughters. One is 15 months and one's 2 months, or 2 months, yeah. And they're a handful. 2 under 2 is challenging.
And girls.
Yeah, both. Yeah, I'm outnumbered in my house.
You're definitely outnumbered.
Yes.
Okay, and where did you live in North Carolina?
I'm from Greensboro, but I live kind of Raleigh, Chapel Hill, Durham area.
Okay, and that's where you did your training?
I did my residency at University of North Carolina, Chapel Hill.
Okay, and how long have you been married?
I've been married for about three years now.
3 years.
It's by quick.
I know, it does. And what's the best thing about marriage? What's the best thing about being a married man?
I think the best thing is just knowing when you come home that someone gets you. You know, you can come home and you can either complain or you can, get something off your chest, and they know exactly how you feel and kind of where you're coming from.
And what's the worst thing about being married?
I don't know if it's being married or being married with 2 kids, but you don't really have any alone time anymore.
You don't have any more of those.
No, your time is everyone's time.
Yeah, I know exactly how that feels with a baby or with kids. If you're taking a shower, you hear like phantom screams or phantom crying, like somebody crying. And I can never take a longer shower than 5 minutes.
No, it's a challenge. And
You're
you got the
always on
baby
go.
monitor in the shower or right up to the door.
That's right,
That's
exactly.
So, doctor, how is a day with you when you're not performing surgery?
It's a normal day for you.
Yeah,
Alright,
it's a
so-
normal day.
Usually I'm either at home or doing something with my family or kids. That can be running errands or, going to the pediatrician yesterday. My oldest got 3 shots, and that's miserable.
But what do you do for fun? What do you like to do for fun?
I love to play golf. Me and Dr. Sherlock, Dr. Murray, we play golf a lot. And so that's probably what I would do if I wasn't with family.
And does your wife get upset if you're playing golf too long?
I wouldn't say upset, but I definitely get some texts questioning how much longer I'll be.
So there seems to be a pattern with our surgeons.
Yeah, I think it's everyone.
So what would you recommend for women out there to know about men that want to play golf, and how can they get you? How can they understand where you're coming from?
I think that the answer is easy. I think that they should just play golf, and they'll play with husband, and then they'll know how long it takes.
And the babies can stay home alone.
Yeah.
There you go. Or bring
like
the
it.
babies with you. Huh?
The downside of having 2 babies so close is they can't babysit each other. So
That's
that's
true.
but
That's true. But you got it. And are you gonna have another one?
we don't know. We were talking about that recently, and so not soon, but deciding if
So you're a kid lover. You love
You
kids.
want to have a big family.
my family owns a daycare center with hundreds of kids.
Oh,
My mom and
really?
dad, yeah. That's where I grew up around it.
Oh, that's fantastic.
Yeah.
I didn't know this about you.
How many kids do you want?
I don't know. 2 right now. We'll see once they get a little older.
So before you have kids, you like think, oh, I want to have 2 kids, I want 3 kids, and everything kind of changes once you have it. You start kind of like, do I really want it? And just the logistics of it gets a little more complicated.
It does. It's not what you expect of it.
And what we talked about, what you do on your time off. Now this is current Dr. McDaniel.
Okay.
I want to know a little bit about the past Dr. McDaniel, not the married man, the non-family man. So I have here 3 shots of Cuban coffee, and for you guys who may not know about Cuban coffee, it's very strong. He is going to be very hyper. It's like 4 Red Bulls in one.
Well, he's not gonna sleep tonight, so.
Yeah,
He's not
give
gonna
me through
sleep.
the night. There you go.
So we've got 3 shots here, and I'm gonna ask you a couple of questions. Well, we're gonna ask you a couple of questions.
Okay.
You can either decide to answer it, or you get to take a shot.
Okay. fair
If you
enough.
don't want to answer it. If you don't want to answer it, you just take a shot and we'll forgive you.
All right.
So,
Yeah.
Yuni, why don't we try with you first?
I have a question, doctor. Before going into surgery, if you make love to your wife, it will make you like inspire. It will inspire you, or it will make you tired.
You think it would make you tired not sleeping with children, but it actually gives me more energy in the morning, believe it or not.
Okay.
So you're a morning guy.
Definitely a morning guy. The problem is my wife is not a morning person.
Oh my God.
So I don't know if it's fair to her.
But she can still sleep in and do this.
Oh, we talked about this in the last. We talked about this in the last episode.
Oh, really?
Yeah.
I'm not a morning girl and I do this.
We call it the dead cow or the pillow princess.
I lean towards the latter with that one.
Wow. Okay. So, what about you? Do you have a question for us?
So if you can do any surgery on your wife,
Mhm.
what would you do? Or you could answer the question or you could take a shot because you do have to pick one.
So believe it or not, I've done surgery all the way.
Okay.
And like you mentioned before, your priorities change. It's funny because I'm answering for my wife, and I think that changes too when you get married. You don't think about what your answer is. But my wife would love to have smaller breasts. Now that she has had children, she would love to have breast reduction, I think, and a lift. And I think that's the biggest change for women because pregnancy does a number on your body, women's bodies. Everyone knows this, and it's something that can be changed and corrected, and really give them their confidence back.
I was just talking about that, and I'm always talking about it. My breasts, ever since I had Julian, look National Geographic. They went from perky and sexy and very Avana to something you'd see on a National Geographic magazine. I'm talking about mammoth-sized
Like the
breasts.
the monkey moms.
Yeah, like they're just huge
orangutan.
breasts. My nipples are probably the size of my head. They're like, yeah, exactly. Like talk about motorboat. Like these are like the motorboating, like the for motorboating. They're just like huge. It is so bad. After you have kids, I am dying to get a breast reduction, but I have implants. They were very cute before I had Julian, and I want to keep them, but I just want to do a lift and I want to do a mesh.
Okay. Yeah.
Because I want these bad boys up.
Yeah. The mesh is a great option. It's
Yeah.
going to give you that structure back. It's going to give you more support.
I feel like they need a hammock, like an extra large hammock.
Yeah.
I want them up to my chin. I
That'll-
want to be able to do OnlyFans just on my National Geographic breasts. In fact,
I love
I should create an OnlyFans channel, National Geographic Mama,
Before and after.
MILF, but like a National Geographic MILF, you know? I'm telling you, I completely understand where you're coming from, and I'm sure women here know exactly what I'm talking about because after you have babies, they really do a number.
They do.
They do. I can't wait to fix them. So thank you so much for answering that. Now I'm gonna ask you about something else. Before you were married,
Okay.
when you were a single man out in the town, were you good? Were you an angel, or were you a little bit of a bad boy? Up.
Take a shot.
First shot. Shot. Shot.
Shot, 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 shot.
Shot.
Okay.
I don't, my kids may see this one day. So
Very good.
I'm always their dad.
Okay, so then we're gonna keep it like that. He is the family man. He is the perfect family man, perfect husband, and he's a fantastic surgeon. And we won't talk about his past as a single man. So, doctor, we want to thank you. I know you have to
Thank
go
you.
back into surgery. Thank you
Yes.
so much for being with us.
Awesome. I appreciate it.
Take care. Bye.
Bye.
So I can't believe he took shots instead of answering that.
That was great.
Oh, he did tell us
It was
privately.
unexpected.
He did tell us privately, so we have to keep it private for him.
Yeah.
Right.
Yes,
Yes.
absolutely.
But it was juicy.
So if you want to do surgery with Dr. McDaniel, send us a DM.
Absolutely. Now that you got to know him, when I really like having the doctors on with us because we get to know them on. I feel like I really like knowing who they are as a person, who's operating on you in the most vulnerable point in your life,
Yeah.
right? It's a completely vulnerable position. You want to know if the person is good, is a good person, a decent person, if he has a sense of humor, if you can feel like you can relate to them.
Yeah, it's
That's
a
really
change
important.
for all your life, so you have to do it with someone that you know that will do good on you.
Absolutely. And so somebody's actually asking, what's a mesh for the breast? So a mesh is something that will be like a hammock. It's made out of porcine, which is pig skin, but it really integrates completely with your body and your cells. And it's almost like a hammock for your breast and your breast implants. So if, let's say you have very loose tissue or loose skin, or you tend to have tissue that isn't going to be able to sustain your implants, this is a really great option for you. I know because of my skin, because I've had so much weight loss and weight gain and weight loss and implants, it is like, it's stretched out. So I'm gonna need a mesh. And I cannot wait to use it because the results that I've seen using a mesh here are absolutely phenomenal. I would love to do a mesh. I cannot wait to have porn star boobs
Just do
again.
it, Gigi.
I have to wait because I don't know if it's gonna have another one.
Oh,
Okay.
They won't drop.
They won't drop. I'm gonna be 80 years old and they're gonna be like, here, I'm gonna be like the queen of the retirement home.
Yeah.
I'm gonna have all the viejitos.
Yeah, you know what how they say, like, oh, imagine what you look like when you're 80.
Yeah.
Well, yeah, I can't wait to see. So Gigi, when you want to have another baby, when do you think that you want to have?
So this is a good question. I'm always going back and forth with my husband about it because he wants to have the baby. I mean, it was up to him to get pregnant like now in the spring.
He loves kids.
He does, and we had such a great experience with Julian. And knock on wood, he is a wonderful boy. He's so good. He's an angel. But I have a feeling that the next one isn't going to be an angel. And she's gonna come out like her mom.
Oh, it's a girl.
Yeah.
And do you know the name? You want
Sophia.
Oh,
Sophia
I love it.
Alexandra.
I love it.
Yeah.
That's a great name.
But I'm not sure. Sometimes I wake up saying, yeah, let's have another one this year. And other times I'm like, I think I'm okay with just one. But
Yeah, enjoy your baby while he's young. And
Yeah.
then you have another one.
wait a little bit, you know, so until he's a little more independent.
Yeah, and that way he'll help out with the
Right.
baby.
You know, I noticed that Dr. McDaniel only had one shot. Do you girls want to have the other shot?
I can't. I'll do it. I'll take it.
All right, you do it. I'm gonna do it with you. Hold on a
Thank
second.
you.
Can you get that for me? Because
Of
I'm having a little bit of
course.
a wardrobe
You're
malfunction.
so sexy today, mommy.
Woo! Yeah, so I bought this dress when I was an extra small, and I wore it at home in front of a mirror when I was standing. I didn't really think about how it would look when I was sitting. When I'm sitting, it shows everything. So
It's beautiful. You gotta show, baby.
I cannot stand. Cheers and salute to all of you. So now that we did a shot, are we supposed to answer some questions? Dooney, ask us a question.
Oh my god, what question should I ask?
Ask
You had
us.
sex last night?
I did not have sex
I
last
didn't
night.
either. I didn't either.
neither. No, but I will tonight.
Okay.
No, that's it. I mean, you don't program it when you're married and with a baby, but it kind of gets to the point where like, hey, I haven't had sex in a few weeks. Maybe it's time.
And what's your favorite position?
My favorite. You
You
know what?
wanted me to ask
I'm
you.
very used to I'm asking the questions. I'm not used to answering them.
Okay.
Dios mío.
You don't have to answer.
No, of course I can answer. Aquí no hay miedo.
Okay. Lo dejamos en la
Um,
gaveta.
No. I think doggy style.
Okay.
Doggy. I think doggy.
Yours,
Yeah.
baby? What's my favorite position is when I'm like laying down on my stomach and I'm like flat on the bed.
Pillow princess.
Yeah, it's something like, you know, like when you're like laying down flat on the bed.
Oh, okay.
Yeah, and they're on top of you, and then that position always makes me come like really fast.
Wow.
Uncensored and unfiltered.
Wow,
Yeah.
Uncensored and Unfiltered. We tell you, this is Uncensored and Unfiltered. There's a little parental guidance sticker on it and everything. And you know what? With that position, you cannot do it so soon after having a breast procedure. You had your breast done. How long
Yeah.
did you wait
To have sex. Oh
to
my
have
God.
that position?
Say the
Um,
truth.
La verdad.
To have that position, like 3 months. Yeah, I waited like 3 months until I was comfortable to move around like that. Maybe 2 months. I was having sex 2 weeks after that.
I thought she was gonna say like 2 hours.
No, I'm not that horny. But like 2 weeks. I waited a good 2 weeks to have sex.
A good 2 weeks.
What about you?
I waited 2 weeks
Yeah.
after my lipo and breast. Yeah, I waited 2 weeks.
I have no problem with it.
No.
And you might
I used to
vibrator and all that. So.
Oh
my
yeah.
God, I've discovered myself in so
And you know what? Speaking of that, we're gonna have a very interesting lineup of programs for you in February. We're gonna have a lot of very fun things to talk about in February. You're gonna want to subscribe to our channel because there are a lot of very fun, sexy activities going on in February on our lives, and I cannot wait to show you guys. And it's not gonna be just us.
Oh
It's gonna be other people. And if you think this is Uncensored and Unfiltered, just wait till you see February because it is the month of love, and we're gonna get sexy, we're gonna get racy.
We're gonna
Of
get
course.
you.
Yes,
It's gonna be
exactly.
fire.
Absolutely.
Fire, baby, fire.
So thank you guys so much. Make sure you tune in to next week's episode. It's gonna be a great one. And thank you again for joining us and for speaking with Dr. McDaniel.
Besitos.
Bye.
Stay safe.